By 2015, the mosquito-borne Zika virus had made itself known in Brazil, just as the Brazilian Ministry of Health observed a spike in the number of babies being born with microcephaly, a reduced head circumference that became one of the marked signifiers of Zika. However, at the time, the link between the two was not yet evident. During the following year, registries in congenital anomalies throughout Latin America were examining their data, while experts from the rest of the world were questioning how to respond as the outbreak worsened. An informal network began to emerge, driven by a humanitarian and scientific purpose. By 2016, when the EU issued a call-out for a rapid research response to Zika, soon after the World Health Organization declared the outbreak a public health emergency, the network was ready to act. More than 200 people formalized themselves as the Latin American Network for Congenital Malformation Surveillance, RELAMS, dedicated to collecting and sharing data to enhance epidemiological surveillance. The rapid global response was facilitated by multiple collaborators, including the Latin American Collaborative Study of Congenital Malformations. Over the next 3 years, RELAMS created a databank of 97 different congenital anomalies, including microcephaly and hydrocephaly, relating to more than 9 million births, including more than 100,000 malformed newborns from Chile, Costa Rica, Paraguay, Brazil, Nicaragua, Colombia, Argentina, and Mexico.
The data bank contains updated information about the frequency of each congenital anomaly in the Latin American countries. Through this, we were able to see the usual frequency of microcephaly in the different regions and to compare them to the emerging situation. Having this information ready to hand is essential because the sooner we can confirm an evidence-based pattern, the more health measures can be taken to search for the cause and take care of the affected.
RELAMS remains in operation today, tracking information from the congenital anomaly registries every 6 months, conducting an epidemiological surveillance routine to ensure any unusual changes in disease frequency can be identified immediately. The databank was just one of the tools to emerge from the Zika Preparedness Latin American Network, ZikaPlan, a transnational network of 25 organizations hosted by Sweden's Umeå University and led by scientific coordinator Professor Annelies Wilder-Smith, alongside project coordinator Dr. Roman Preet. The consortium, funded by the EU to provide an immediate response and build long-term capacity in the fight against infectious diseases, galvanized links between clinical research teams in multiple disciplinary and geographical regions. Dr. Helen Dolk was one of the researchers who contributed to the initial response. She had already been working on congenital anomaly surveillance as part of the European Surveillance of Congenital Anomalies Network and the Global Burden of Disease project.
So I had been wondering to what extent we could use mobile technology to bring some of the visual guides that exist to non-expert health professionals to help them identify congenital anomalies for surveillance and research. Of course, mobile networks are very well developed now, so there seemed to be huge potential. When the Zika epidemic started, that was a perfect example case of how one might use mobile technology to help record cases of microcephaly and congenital Zika syndrome. So that was what started this app off, and we developed it with a large committee of congenital anomaly experts across the world to try and validate its use well.
The resulting Global Birth Defects Description and Coding app helped to plug a gap in local expertise and resources for the identification of congenital anomalies, a leading cause of infant deaths worldwide. The app contains images of 98 externally visible birth defects and 12 syndromes, including congenital Zika syndrome, along with definitions, photos, and diagrams that teachers and local healthcare workers can use to identify and code major externally visible birth defects for surveillance and research purposes. To date, it has been downloaded more than 1,000 times across 38 countries, supporting global efforts to prevent congenital anomalies and care for affected children and their families. The app also marks a significant step towards meeting the UN Sustainable Development Goal of reducing neonatal mortality and child deaths. In Brazil, the app is being used to train health professionals in the use of a new surveillance system. In Uganda, it will soon be tested in the Case Control Birth Defect Surveillance System. In Burkina Faso, the app is to be used in a new project focusing on microcephaly. In South Africa, it is being adapted as part of a new perinatal health information system. In Kenya, the app will soon be used for a project investigating the safety of anti-malarial medications. Right now, the app has the potential to track the impact of the COVID-19 pandemic by monitoring the prevalence of congenital anomalies among newborns. Other innovations have also focused on the power of networks and technology.
We decided to launch a really exciting initiative called the Global Vector Hub. And essentially this intends to do three different things. So one is to provide access to data so that we can pull data from lots of different sources into one place and people can access that data really easily, and also help to interpret the data so that you can see what is going on. If you're a policymaker within a country, you can download the data and interpret it yourself so that you can make informed decisions. Or if you're a researcher, you can access the raw data to be able to do your analysis on that. The other thing that this resource does is it provides a series of useful resources. So these might be standard operating procedures or risk assessments or methodologies or guidelines around vector control and vector-borne diseases. Again, these are scattered throughout the literature, but we've brought these all together in one place, as well as training materials. So you can come to the Global Vector Hub to be trained on how to do vector control successfully. And then the last part of this is a network. So basically, who is where in the world and what is their expertise? So if you want to find somebody who's working on a particular area, a particular insect, a particular disease, then you can log in, you can find those people very easily, and you can talk to them through this network. And through this whole combined effort, what we aim to do is to help to build capacity, not only in Latin America, and it was certainly the Zika outbreak that spurred this on and really sparked this initiative, but much more globally. Mosquito-borne diseases are not just bound to one country. Lots of these diseases are found right across the world, particularly in the tropics, and this is a big problem. So the Global Vector Hub will not only address Zika, it will address other diseases like dengue, yellow fever, and even malaria, and beyond into other diseases transmitted by other insects as well.
Thanks to the efforts of everyone involved in Zikaplan, the global health community is better equipped in the ongoing fight against infectious diseases.